In this video, we will go through some of the important anatomy and physiology terminology. It is important to note that we will not describe and discuss in detail every term that is important in this course. This video instead is intended to give you some tips and help you to understand how to study and efficiently use the terminology. Let's start with the levels of human structure. All humans exist as an organism. The organism is the highest level of structural hierarchy that we can look at. So if we go over here to this picture, you can see that as a human, we represent an organism. An organism is an incredibly complex collection of organ systems, organs, tissues, cells, organelles, molecules, and atoms. If we go down this hierarchy step by step, we can see that the next largest group in this organizational hierarchy is an organ system. In another video, I will go through each of the important organ systems as an overview so you can understand what you'll be learning in the subsequent lectures. Organ systems are composed of different organs. An organ is anything composed of two or more tissue types. A tissue is the next lowest level of organization that we'll get to in just a moment. So a couple of examples of organs we'll see are things like the heart, kidneys, skin, muscles, and bones. So if we go back to our original picture that we were looking at, you can see that if we think about something like the organ of the heart, that organ is going to be part of an organ system that we know as the cardiovascular system. Different tissues are used to make up an organ. A tissue is a group of cells and some products of the cells that work together to accomplish an important specific function. We will learn the four major tissue types in the body: epithelial tissue, connective tissue, nervous tissue, and muscular tissue. So, some of these you can probably guess the organs that the tissues are responsible for producing, such as most of your muscle organ will be composed of muscular tissues with some connective. The majority of your brain, spinal cord, things within your nervous system will be made of nervous tissue. Epithelial tissue we will find in very large amounts in the skin, but also in other places. Connective tissue represents some of the most diverse tissue types that belong to that same category. Cells are the smallest unit that is capable of carrying out a function of life. Different types of cells work together to produce a tissue. And remember, different types of tissues, at least two, work together to make an organ. Multiple organs work together to make an organ system, and all the organ systems work together to produce the organism. Recall from your previous biology classes that a cell is going to contain a nucleus, which is your central processing unit of the cell, and various other organelles. The organelles are the microscopic structure within the cell that each have a very specific job to allow the cell to function. In addition to that nucleus, you may recall certain organelles such as the mitochondria, which is very important in helping the cell produce energy. You may have learned about lysosomes. They are the garbage disposals of the cell. So we'll go through all of these different organelles in another lecture. The organelles are all composed of molecules, which are composed of atoms. To truly get an accurate understanding of molecules and atoms, you really need to take a chemistry course. So now let's move to a few more of those important terms. One of the most critical terms to become comfortable with in anatomy and physiology class is the idea of anatomical position. Anatomical position allows us a reference. If we don't have a reference point, when I say on your right, that may depend on which way you're standing. If I say facing a certain direction, well, it depends on which way you're standing. What if you're doing a handstand versus when you're standing on your feet? What about lying down? That could change your reference point. So we must have this reference point. Anatomical position is defined as a person standing exactly as you can see in this picture. The patient or person is standing upright, so standing on the feet. Feet are flat on the floor, facing the same direction. The head is facing the same direction as the feet. Arms are sitting by the side. And notice, very important, the palms are facing towards the toes or towards the observer. So if we pretend that I'm the physician or the nurse or the physical therapist that's working with a patient, when they're looking at me in anatomical position, my right side, when I'm looking at them, is actually on their left side. Pretend you were trying to shake hands with the person in this picture. If you stuck out your right hand and touched the hand that was closest to you, that would be this person's left hand. So again, anatomical position, standing upright, feet flat on the floor, head facing forward, arms down by the side, palms facing forward as well. Now that we have our patient in anatomical position, we can learn about the anatomical planes. These are different, as gruesome as it may sound, slices you can make into the body. And so in this picture, it looks as though a pane of glass has been sliced into this person. So you can see with the sagittal plane here, we have cut this person into a perfect right and left half. This picture actually represents what we call the mid-sagittal plane because it's dividing her into perfectly equal left and right halves. We could move this piece of glass slightly to the patient's right or the patient's left, and it would still be a sagittal plane, but not a perfect mid-sagittal plane. The transverse plane divides the person into a top and bottom half. Sometimes the transverse plane is described as the horizontal plane. So just be comfortable using both terms. Lastly, this frontal plane divides the person into front and back pieces. The frontal plane is also described as the coronal. You can use these same planes as a way to properly visualize what's inside of the body. So this picture here at the top, this is a mid-sagittal section of a female body's lower portions. We'll learn those proper terms in just a moment. But you can see that once we cut this patient into this mid-sagittal plane, we can actually see the organs on the inside. This is part of the digestive system. This is the urinary bladder. This is the uterus. So you can actually begin to identify different parts of the body by cutting the body into sagittal planes. This is a second picture, shows the lungs using that frontal or coronal plane. So you can see not just the lungs, but you can see the heart in the center. Cut in half, you can see the chambers we'll learn about, the atria, the ventricles. And then the bottom picture is a transverse section of the head. So we can actually visualize different parts of the brain here, and then you can see the eyes. So lots of different things can be seen when you use the different planes. So now let's switch to body regions. The term axial region describes everything but the limbs. So your axial region will be your head, neck, and trunk. The trunk, or the portion of the body that we think of kind of as the chest and stomach regions, those are known as the thoracic region. Thoracic is above the diaphragm, so thoracic has things such as your lungs, your heart. The abdominal and pelvic regions are below the diaphragm. The abdominal and pelvic regions are what we typically call things like our, quote, stomach. But don't worry, in A&P class, we're going to get a lot more specific than a stomach. So again, that's the axial region, everything but the limbs. We call the limbs and the parts of the body that hold the limbs on the appendicular region. So if we're trying to think of this as a nice categorization, then we have the axial, that's all of the parts thoracic, abdominal, pelvic. If we think about appendicular, that's going to be your limbs. So we're going to further divide these parts so we can get a little more specific when we're describing where things are located. The abdomen itself has 4 different quadrants: right upper, right lower, left upper, and left lower. So if we look at this picture, it shows you in detail. Remember, our patients are always in anatomical position. So when you're looking at it, your left is actually the right side. So right upper and lower, and then left upper and left lower. If we come to the picture on the right, you can start to visualize what's inside of each of those quadrants. So notice we have some intestines in each quadrant, but we only have ribs in the upper quadrants. And we'll learn more of these organs as we go along. The 9 regions of the abdomen are divided by 4 intersecting lines. You have vertical lines, upper horizontal lines, and lower horizontal lines. And you can see that those even are divided into more specific names. So let's take a look together at the appendicular region. Again, the appendicular are your limbs. Your upper limb, of course, I'm sure you know, is divided into your arm, forearm, wrist, hand, and fingers. Your lower limbs are divided into your thigh, leg, ankle, foot, and toes. Every single body region on the outside has a proper name. So the good thing is, as you begin learning these, some of them are a little more obvious than others. For example, most of us know that our umbilical cord was attached to our belly button. So it's not surprising to know that the belly button's actually called the umbilical region. So some like that are a little easier to learn, but others, you're just going to have to learn them. But I will tell you, spending time learning these proper body regions now is going to help you when we get to the bones and the muscles. You'll have less to learn then. So I'm not going to read all of these to you. I know you're capable of that, but just make sure that you spend some time learning. My best tip for learning is to take this image, remove the terms, and try to practice labeling yourself over and over again. If we look at the head, the cephalic region is the entire top portion of the head. The facial is what we call our face. Cervical is neck. Once we move into the thoracic or chest region, the sternal region is the very center, and then the pectoral regions are on each side of the thoracic region, typically where the pecs muscles and breast are located. Abdominal is more obvious. Inguinal is what we call the groin. Now switching over to your right, the left upper limb, we have the shoulder is the acromial region. Axillary is the armpit. Brachial is the upper arm. Cubital is the elbow. Antebrachial is the entire forearm. Carpal is the wrist. Palmar is the palm. Now moving to the lower limb, coxal is the entire hip. Femoral is the upper leg. Patellar is the kneecap. Crural is what we know more commonly as our shin. Tarsal is the ankle. The plantar surface is the arch. The entire foot is the pedal region. So again, you just have to spend some time learning those. A few names are different on the back. A few important ones, we have the scapular region, which are your shoulder blades. Vertebral is your entire region where your vertebrae are located. Lumbar is your entire lower back. Sacral is the small portion at the very bottom of your spinal column. Gluteal is your buttock region, both sides. Popliteal is the back of the knee. It has a different name than the front. And then calcaneal is the heel region. So please spend some time learning those. Within the body, we have body cavities and membranes that each have specific names. If the body cavity contains internal organs, it will be lined by membranes known as the viscera. Body cavities that are open to the external environment, those are lined by membranes known as the mucous membranes because they produce mucus. So let's look at a picture to talk about these different body cavities. Within the head, we have the cranial cavity. The cranial cavity houses the brain. The vertebral canal houses the spinal cord. The thoracic cavity houses both the lungs and the heart. We'll separate that in just a moment. The abdominal cavity contains the majority of the organs of the digestive system. And the pelvic cavity, it contains most of the organs of the reproductive and urinary systems. Now if we get an anterior or front view, we can see that within the thoracic cavity we have the pleural cavity that houses the lungs. We have the pericardial cavity that houses the heart. The entire center is known as the mediastinum. And then you can get another view of that abdominal and pelvic cavities. Each of these cavities is going to have a membrane. The pericardium is surrounded by a serous membrane known as the pericardial membrane. The pleural cavity is surrounded by membranes known as the pleural membranes. Within the abdominal and pelvic cavities, we have the peritoneum. The peritoneum is the serous membrane lining the entire peritoneal cavity. And so I'm going to show you that, I believe, in a picture in just a moment. Yes. So this we're looking at is, try to remember, what type of section have we done to this body here? That is a transverse, also known as horizontal section. So what we're looking at now is this is the front and this is the back. And so this is cut in the abdominal pelvic region so we can see the different cavities and membranes. Okay. So you can see here in the center, this is the spinal cord. Excuse me, that's the vertebrae with the spinal cord here. Okay. This is another portion of the vertebrae. What you see at the outer edge, that is muscles. Okay. But if we start to look to the inside, we can see some organs. These are kidneys on each side. Okay. So notice surrounding the kidneys, we start seeing these light blue to white looking lines. Those lines are trying to show you your serous membranes. So you have your visceral peritoneum. The visceral peritoneum is what's actually around each of these organs. The parietal peritoneum, that is what's surrounding this large region on the outside. Don't stress. At this point, you're not really ready to identify everything that you can see in this picture. Just want you to have an understanding that we have these nice membranes surrounding everything, really, so we jump around, we move around. Our organs don't just move everywhere. Everything is in a specific place. Again, you can see this if we look at a sagittal section as well. You see around each of the organs, we have some visceral peritoneum around the organs. Then around the outside lining of the cavity, we have this parietal peritoneum. A few other terms. Anything that is considered retroperitoneal lies directly against the back or posterior body wall. Anything that is intraperitoneal is surrounded by that peritoneum. It's an organ that's actually, you can think of it as almost looks like it's floating around inside. So this ends our lecture on strictly looking at importance of terminology and how to identify that terminology. So make sure you're comfortable using the sections of the body, the different body regions, the different body cavities, and beginning to understand the importance of those different membranes within the body.